David, thank you for being here, and I specifically wanted to thank the mayor for being here. We have had a great partnership over the last several months dealing with a lot of tough issues down here in regards to the Ahmaud Arbery situation, and we have been working hand in hand to make sure that folks were able to voice their opinion and demonstrate and protest in a way that, quite honestly, it was called for. And I think that's been a model for the country, Mayor. A lot of people didn't realize that because of your leadership, Sheriff Jump and many other community leaders keeping calm and letting their voices be heard. I know Congressman Carter's been down here. You never heard a word about that before the unrest that we've seen across the country because of the injustice, quite honestly, that we all saw with our own eyes. So, Mayor, thank you very much. You know, we are in challenging times in our state and in our country. But that being said, there are some people that we need to thank that have been on the front lines of this COVID-19 fight for a long time. And that's all the doctors, nurses, their support staff. We cannot say thank you enough. You are our, lumped in with our heroes now. I know myself personally, I pray a lot for our armed forces. I pray for our law enforcement. And now I'm praying for our healthcare workers every day because they're on the front lines just like our law enforcement, just like our troops are. So thank you all. Our first I know you all have seen this here, literally, and it's been this way around the state, but all of our first responders, EMTs, law enforcement, our National Guard troops have just done an incredible job, as good or better, probably better in my opinion than anybody in the country responding to COVID. They've shown remarkable leadership and determination and commitment, quite honestly, during the healthcare crisis. I also want to thank our hospitals, those that work there, as well as all our healthcare workers, whether you're in public health, the hospital, at local clinics, doctors' offices, pharmacies, and other things, our local businesses and community leaders, for helping us make great progress in the fight against COVID-19. And because of that, our hospital surge capacity is prepared and is solid. Our case mortality continues to decline. And you haven't really heard that much because you always hear all the negatives of everything. But that's really something that's good that's been happening, and we want that to continue to happen. Our mortality rate's fallen. We've also been rapidly increasing our testing across the state with 160 now testing centers across the state, continuing to make great strides every day in the amount of testing, which the more you test, I know people won't note this, but Dr. Toomey and I both said 3 or 4 months ago, the more we test, more positives we're going to see. So we don't let the negative get down on the positive of what we're seeing every single day in our state. But there's no doubt we continue to have spread in our communities and across the state, and we're seeing it, quite honestly, in many places across the country. And we've seen those upticks, and that is what makes it a clear reminder that we are not out of the woods yet. We've got to continue to remain vigilant in the fight to protect the lives and the livelihoods of all Georgians. And I've been telling people at every stop, as long as we've been dealing with this, which is not that long, it's been 4 months, but it's like Dr. Adams, I think, said earlier, it seems like 4 years. We cannot be complacent or grow weary. Many of us, and you especially, and those that are behind us on the other side of these walls, have been working very long hours for many, many days now. But we cannot grow complacent or weary. We have got to keep fighting. This is a new day. It is a new challenge, and it's a new time to hunker down and chop some wood. And that's exactly what we're going to do. And as you all know, as we go into this July 4th weekend, celebrating America's independence and celebrating those that have fought and died for those freedoms that we all have and the ability to honor them, this is an important weekend. And it reminds us as well that all Georgians and all Americans have made great sacrifices during this pandemic. And quite honestly, that has been our responsibility. And we're traveling this state to encourage all Georgians to continue to do that and to do the right thing. And it's not that hard to do. Practice social distancing. Use good hand sanitation, wash your hands, and where appropriate when you're out in public settings, wear a mask. It'll work. By following this guidance provided by public health officials, you can protect yourselves, you can protect your loved ones, you can protect this local community, and you can protect our state. And that is the simple message that we have. But you are not in this fight alone, I can assure you. We are all pulling together and fighting hard for the same goals. And with that, I know it's going to be a very busy weekend down here. There's a lot of your friends and neighbors, and I even saw a car tag from Florida, believe it or not, just a few minutes ago, that will be joining us. And we're glad they're here. We just want them to help us be part of the solution, not part of the problem. So just do your part as you're out and about. You know, don't go out if you don't need to, but if you do, try to socially distance yourself, and if you can't, protect others from you, potentially protect yourself, and wear a mask. And with that, I hope you all will give a warm Brunswick, Glenn County, Golden Isles welcome to our Surgeon General, Dr. Jerome Adams. Dr. Adams.
Well, good afternoon, everyone. I know you're tired. I know it's hot. Good afternoon, Georgia. Good afternoon. All right, where are my medical students at? Come on up here. Stand behind me. So, in case you all didn't know, July is when the medical students start their new rotations and usually start up again. And so it's an exciting time of year for someone who's spent the last decade teaching medical students. All right, we got a social distance though. You got to back up a little bit. The TV cameras can still see you. All right. Good to have you here. You know what? I got some hand sanitizer here. Let's give the TV camera something to look at. Let's show people how to properly hand sanitize.
Really lather up.
Also remember to have an abundant supply.
And make sure if you're going to use hand sanitizer, rub it in between your fingers, both sides of the hand. Get it good. Get it good. You know, a lot of different conversations we've had today. The governor and Dr. Toomey and I have had a really excellent day talking to the people of Georgia about how they can stay safe. But I want to talk to you all a little bit about false choices. Because there's a lot of false choices presented out there. And it's easy to talk about COVID only from the standpoint of the negative. People want to present a choice between recovery and reopening or protecting ourselves from COVID. People want to present a choice between you either being pro-mask or pro-freedom and individual rights. They want to present a choice between you either have to be optimistic or hopeless. And all of those are false choices. We can acknowledge the severity, the urgency of the moment, and we absolutely must. 130,000 people who've lost their lives to COVID. Make no mistake about it, this is a somber situation. But we can also acknowledge the progress that's been made in a short amount of time to deal with this terrible, terrible virus. And we can acknowledge that we have the tools to be able to stop the spread of this disease. And so I want you all to really think about what you can do from the standpoint of citizens to help us slow the spread of this disease, because the biology of the disease takes about 2 weeks for you to get exposed to it and then get symptoms. That's maximum. That means if we all wore a face covering or a mask right now, we could substantially slow the spread of this disease in 2 weeks. As bad as things look, 2 weeks from now, it could be very different if we and everyone around us took those simple steps. I want to do the same thing that the governor did and thank all those healthcare professionals who've been at the front lines, all those public health professionals, all the supporting people, the essential workers who've been out there. I mean, we can't forget about the restaurant workers, the the people who work in grocery stores, the folks who are putting their lives on the line for all of us each and every day as it relates to COVID. And I also want to acknowledge that this pandemic has hit certain communities hard. It's hit elderly people hard. We know that the older you are, the higher your risk. It's also hit people of color very hard. We know that blacks are 5 times more likely than whites to be hospitalized and die from COVID. We know that Hispanics are 3 to 4 times more likely to die. And we know that health disparities are a measure of social justice or social injustice. We know that the fact that black women are 5 times more likely to die during childbirth as white women is one of the reasons people are frustrated and that you see these protests around the country. And I really do think that we have an opportunity to change our society for the better and to really address health disparities at places like this, like Southeastern Medical Center, to do small things that will ultimately add up to a large difference in time regarding opportunities for people to be their healthiest selves. I want you to know that I put out a Surgeon General's prescription several months ago on how to respond to COVID, and it's even more relevant now as we continue to reopen. 3 simple steps. Number 1, know your risk. Know whether or not you are at high risk or low risk for COVID-19. We know that people who are obese, who have diabetes, who have high blood pressure are at higher risk for COVID-19. We know if you're older, you're at higher risk for COVID-19. If you are at higher risk, you need to be aware of that when you're making decisions about whether to go out in public or not. Number 2, know your circumstances. Are you going to a setting where you can be outside or inside? Are you going to a setting where you can social distance? Are you going to a community where disease spread is high or where it's low? And then number 3, know how to keep yourself safe. If you're high risk and or you're going to a high risk area, stay home. Stay home. That's the safest thing we can tell you. If you do decide to go out because you are at lower risk or because you have to go out, simple steps you can take: social distancing, good hand hygiene, and again, wearing a face covering. And remember that false choice I told you about earlier between face coverings or individual liberty? As we go into the 4th of July, and I heard the governor say this earlier today, it's important that when we think about our freedoms, that we think of masks as an instrument of freedom. Because if we all wear our masks out in public, we will slow the spread of disease. If we slow the spread of disease, more places will open, more places will be able to stay open, and we will have more options in the future. If you want to go to spring break next year, wear a mask. If you want to see Georgia play Florida next year, wear a mask. And I really do mean that. If you want to have prom, young people, wear a mask. Because the more we cooperate with these basic public health measures, the more opportunities and freedoms we have. The fewer people who wear these, the fewer opportunities we will have. You will have less freedom if you don't wear a face covering or a mask. And I mentioned young people. We know that in many communities, the average age of people getting COVID-19 has fallen by up to 20 years. The governor told me just yesterday he was in a community where 53% of the new cases are in people who are 18 to 35 years of age. So we need to figure out how we reach those individuals. We need to help them understand that it's not just about their risk. They could take the disease home to their mother or to their grandmother or to someone who they don't even know who may be getting treatment at the cancer center right here and put them at risk. But we also want them to know that they will be able to go to the beach. They'll be able to go out to homecoming. They'll be able to go out with their friends sooner and for longer if they wear a face covering and practice social distancing. But if not, you all saw what happened in LA County yesterday. They opened the restaurants, they closed the restaurants. You don't want to put the governor in a position where he has to close things down, and that doesn't have to be our reality. But we control that. We control that. The governor doesn't control that. I don't control that from Washington, D.C. Each and every single one of us controls whether or not those restaurants, those beaches, those churches, those schools open by whether or not we choose to practice the basic public health precautions that we know will be effective. So I want to close with a couple of quick points. Critically important that as we go into this 4th of July weekend, we take extra precautions when we're thinking about going to fireworks displays, going over to families' houses for picnics, going to the beach, that we social distance and we wear a face covering if we go out, but that we always remember the Surgeon General's prescription, because I don't want any of you to put yourselves or your loved ones at risk. Next week, things to think about. If you have been in a situation where you might have been exposed, you need to get tested. And Dr. Toomey is going to talk to you in just a bit about contact tracing. You need to be receptive to contact tracing so that we can quickly figure out who's been exposed and prevent further spread of the disease. And as we go into the fall, it's critically important that every single one of you get your flu shot. I'm not going to ask you to raise your hand if you got your flu shot last year. I'm not going to embarrass anybody. But the average rate for adults getting their flu shot is less than 50%. So everyone's talking on the news about the vaccine for COVID and how quickly we're going to get it. And is it going to be here by December? Is it going to be here by January? You know what? It doesn't matter when it gets here if half the people in your community don't get vaccinated by it. You're still not going to have that herd immunity that we need. So we need people to understand vaccines are safe and effective. We need them to get their flu vaccines because we don't want a double whammy of a bad flu season on top of a bad COVID season. And we need to do the things that will help keep us safe. We're facing an unprecedented challenge, but I'm optimistic. I'm optimistic because I've seen the data. And as bad as things can get very quickly, things can improve that quickly. It's just up to you to decide that COVID stops with you and me. And so I'm going to ask you all to say with me on the count of 3 that COVID stops with me and you, because it's important that we all take ownership and that we help everyone else around us understand that they need to take ownership. On the count of 3, COVID stops with me and you. 1, 2, 3. COVID stops with me and you. And you said it out loud. I hope you felt it in your heart. I hope you live that out this weekend. I hope you live that out in the weeks ahead, because if you do live it out, it will only be weeks that it takes us to get over this. If you don't live it out, it could be months and more that we're still dealing with this and that we're missing all the things that we love and enjoy in life. Together we'll get through this, Georgia. I'm confident of it. You've got great leadership here. We just need you to do your part. Thank you.
No, thank you so much. I'll talk very quickly, I promise. But I, first of all, want to thank the governor so much for his leadership and inviting me on this tour with him, because he is sharing a message that's so important to hear for us at this time, while so many people in the medical care system, in the public health world, have been working so hard. These aren't months or just long years. These are dog years. That's what it feels like to me. I've been working on this almost nonstop since mid-January. And it's really an unprecedented situation. And yet we're trying to change the way people think about prevention and even what they do and how they do it, literally overnight. And some of you are as youthful as I am. You may remember that we used to smoke on airplanes. Yes, you remember that? We did. I mean, not me, of course, but many in my family. I'll say that. And there was a time when we didn't have seatbelts either. And yet now, we just do this by second nature. But wearing a mask has become such an issue that sometimes, at least in our world in Metro Atlanta, people wearing a mask are actually ridiculed, harassed by others in the store. And in fact, it should be the other way around. We should be modeling that this is absolutely the coolest thing you can do, because we're joining together with our community to stop the spread of COVID so that we can enjoy life in Georgia. And there's so many opportunities coming up that we don't want to miss because we haven't taken advantage of these prevention interventions that are so simple if we all do them, if we all follow this guidance. And so again, I'm grateful for the governor's leadership in this area, because this is something that we can all do and stop the spread in Georgia. There's one more thing I'm going to ask you to do, and Dr. Davis and his team in the Coastal Health District have been working very diligently on something called contact tracing. It's something we've done in public health for many years, but it's particularly important with this, which is a respiratory virus which spreads so easily in the community from person to person. And we know that wearing a mask and social distancing can stop the spread. But if you do become infected, if we can find the people that you've been living with, exposed to closely, we can identify them quickly, help them be isolated or quarantined within the community, get them tested quickly, and then literally stop the chain of transmission so we don't have new cases. And perhaps not surprisingly, we haven't had the full cooperation throughout the state of people wanting to take that call. And so I just want you to remember and to share with everybody, all your friends and relatives, your neighbors, those in your community, take that call when you get that call. I for one, want to, not only, this is personal to me, I want this virus to end. I want schools to be open again. I really want our kids to go back to school. And we have to do this so it's safe for them to go back to school.